Hello again, everyone. Edwin Learnard back once again. In this YouTube segment, I'm going to be giving you my coronavirus COVID-19 update for January 19th, 2021. Now, according to worldometers.info, the coronavirus cases that we have up to date at this time, or as far as January 19th goes, about 96 million. This was updated at 3:13 p.m. GMT on the 19th of January 19, 2021. The deaths are over 2 million, but the recovery, as far as amount of people recovered worldwide, about 69 million. Of course, I'm giving you the world global totals on that. And another thing I thought was interesting, they're talking about they had some info on the cases. Um, closed cases which had an outcome are almost at 71 million. Uh, and active cases are about 25 million. So there's, according to worldometers.info, we have about 25 million cases that are active right now. So the thing about this is, this is something that's a very prodigious pandemic, to say the absolute least. And another thing that I wanted to get with you, as far as a specific country, the United States. Now, the United States looks like it's starting to make significant progress in terms of as far as the people that are affected. You have as January, as far as the New York, looking at the New York Times.com page for the coronavirus updates, and it was last updated January 19th, 2021, 7:54 a.m. is the page I'm looking at right now. And right now, though, we have in the United States the total, as far as cases go, confirmed coronavirus COVID-19 cases for the United States has eclipsed 24 million, but on January 18th we had 142,587 confirmed cases, which has dropped significantly per day over the last 2 days. A couple days ago, I think we had over 200,000 cases on that day. As far as that would be the data for, of course, January 16th, and over the 14-day change, we're at -7%. So that's obviously showing certain improvement. The Pfizer, Moderna vaccines are obviously factored into this, and they're playing, I'm sure, an integral role in these numbers starting to decline and drop. Now, another thing, I mean, we look at this as well, and again, this is something we can't really take lightly. Lightly. We got to take our precautions still, and try to we need to practice social distancing, wear the mask. That can't be stated emphatically enough. I understand you have skeptics out there that think these numbers are distorted and they're enlarged. I don't believe they are. I don't think this is fallacious. I think this is actually very real, and this is something that can, of course, be more prevalent during the winter period. Now, based on what I've researched, the coronavirus itself may not show favoritism in terms of the temperature and season, but it's not the winter can indirectly make this more prevalent and prominent, because according to what I had researched, what happens is you go into when you go indoors more, there's more of a tendency for families to congregate indoors, and the fact is the air is dry. It's something about the way it moves, I believe, through the dry air. And also keep in mind, when you have more activity indoors, and if you're very casual and you become complacent, and you have family members, say close friends, that are in close proximity to you, and you're not wearing the mask, that could increase the propensity to get this coronavirus COVID-19. Now, as far as any any new updates on this. I saw something. Well, this is not a new update. I honestly did not know this until I researched this. That now the Moderna vaccine seems to be, it's around 94% effective as far as this. I guess if the word we could use is efficacy, and the Pfizer is about 95% as far as its efficacy. So both being over 90%, obviously very effective. Now there was some report that there's possible side effects. It's not, I don't think this is anything confirmed, but there was something about a report, according to usatoday.com, there's a report that states that there may have been possible allergic reactions to the Moderna vaccine. The thing we have to keep in mind with these vaccines is that it's not, obviously it's not going to be flawless or infallible. It's not 100% effective. For one thing, you're getting, with the Moderna and the Pfizer vaccine, you're having about between 94-95% effectiveness with them, and also there's obviously got to be some propensity for side effects, for some adverse effects. And as I stated, I believe in the previous video I made from yesterday, as far as the coronavirus update goes, is the fact that I think there's still a lot we don't really know about this, that we're not cognizant of as far as this coronavirus, as far as these vaccines go. For example, if you're taking certain medications, can the vaccine cause some adverse effects with the combination? In other words, having the combination of the medicine and the medications in your system with the vaccine, can that produce some adverse effects? So those are some things that we're still learning about. We need to become more learned about as time progresses. But I do see that there is light at the end of this tunnel. I mean, the United States, the numbers are starting to drop dramatically, it seems like. And then when Biden is elected, I mean, I know there was some report that the 100 million of these, there was some deal he had made, I think it was with Pfizer, that there was going to be 100 million, I don't know if it was doses of this in 100 days. So it seems like that's a very prodigious amount, and it shows that we can really get this thing reduced as far as the confirmed cases dramatically, maybe sooner than later. And being prayerfully, hopefully, I would say we could be looking at, by the end of this calendar year, by 2021, that is when I believe this will go down to a point where we're going to feel safer, where we're not going to be, the state of trepidation, going outside and mingling with others, going to places where others congregate. I think this will drop to a point that's realistic, that we can work with. And of course, that number is subjective. But my number for that, in terms of as far as confirmed coronavirus cases per day, if it could get down, say in the United States, for example, if it gets down to 5,000 confirmed cases per day or less, that would be a very realistic number, because you're talking about an average of about 100 per state then. And 100 may seem like a lot, but when you have 100 cases spread out over a whole state, it's really, I would say it's a fairly minuscule amount. And if it got to that point, that's when I would believe where people will start to relax a little more and feel like, they can move around and go outside and not be quite as frantic or frazzled or whatever you want to call it regarding this coronavirus. So anyway, people, that'll conclude this YouTube segment for my coronavirus update for January 19, 2021. Until next time, people, Edwin Learnard saying stay well.